following is the most appropriate intervention for the mother during the remainder of her pregnancy. Okay, so pregnant woman, 28, to opt for prenatal visit. She has been living in a remote area with limited access to iodine salt. Ultrasound reveals a fetal with a large anterior neck mass, and amniocentesis confirms the presence of a homozygous mutation in the sodium iodide transporter gene. Which of the following is most likely intervention? So, she has a neck mass, so I assume like a goiter, thyroid related issue. So if you have a neck mass and she has limited access to iodine, let's see, mutation in the sodium iodide transporter. I think right now I'm just verifying if there's too much or too little. If I had to guess, because of the limited access and then maybe a transporter issue, there's no iodine, and so you need a, let's see, let's see. If you need to give more,
Okay, what do you want to give?
well, she's probably levothyroxine.
Final answer.
Yeah.
So actually, iodine here will help here. Okay.
The only
So
thing that's, I don't know if I was overthinking it or not, but the fact that she had limited access, I didn't think she could get supplementation. So I don't,
okay, yeah, yeah. So here's the thing, right? Limited access to iodine salt. So recommend iodine supplementation. And so you can, I think there's probably pills you can probably take if I'm not mistaken. So you can probably prescribe stuff like this. Just the best answer, going back to kind of how step questions are written, you want to pick the most direct, right? So if you initiate levo, right, mom doesn't have hypothyroidism, right? It's really fetus that has hypothyroidism. Okay.
right.
So the way you want to first do this is you know that for a fact that mom has iodine deficiency. So the best way you want to do is give mom iodine so that mom can create more thyroid hormone, which then can give to kiddo. Does it make sense? All right. There's and mom also doesn't have hypothyroidism, right? Mom doesn't have hypothyroidism or symptoms of hypothyroidism, right? And so you can't give levo for the baby and cause mom to be hyperthyroidism, right? So that wouldn't work out. So just the best one here is that they're telling you a lot of things about, oh, mom doesn't have iodine salt, mom doesn't, the iodine transporter, right? All these things about iodine. So you want to pick an answer that deals with iodine on a test taking strategy standpoint.
Okay.